copy, thank you. Okay, so that's 11673.
What type of medications did you see next to her body? Keep doing it. Oxycodone. You know how many milligrams or how much was in the bottle? You see only 30 pills left? Okay, gather them because you may need to show that to the paramedics.
Hello everybody, my name is Dr. Kimo Alameda. I'm a psychologist. I live on the Big Island, and I'm very excited to share with you this presentation on opioid addiction and opioid abuse. And the name of this presentation is Painkillers Kill. And this is a biopsychosocial approach to addictions and pain management. Opioids can be a blessing and it can be a curse. Let's look at some statistics. 2018, if you should translate these statistics every 6 days, you'll find that every 6 days, one person in Hawaii dies of an opioid overdose. And 25 people in Hawaii almost die if it wasn't for a first responder to come to their aid. That's unbelievable.
I didn't think I was addicted until I tried to stop. I ran out of medication after using it too quickly, and I started to go through physical withdrawals.
Wow, and what kind of withdrawals?
I would feel cold sweats, sleepless nights, increased pain, I couldn't focus. It affected me in college because I actually used to use the medication to enhance or help me with schooling, and when I ran out, I was unable to do any of my work, eventually dropping out of college. It was hard on my family because while I was away, I was lying to them. Not only that, but I was asking them for financial help, and they knew something was wrong, but they had no idea what it was.
With pain management, opioids are not bad. They are there for a purpose. They do serve a specific purpose to help treat chronic pain and acute pain. However, there is a very fine line between it being helpful and it becoming an addiction.
The image that our public has about people who are on opioids is sort of that individual that's on the streets, that has really no home, has mental illness, but it could be someone like just one of us. We could be amongst them and not even know that they're functioning individuals on the drug. So when you start to look at the sort of clientele that you see on a national level, the ones that are coming in with opioid addiction is the ones who are there from affluent families. Individuals that we see, that we treat here, are more so attorneys, first responders, EMT, doctors. It's not so much the community that we serve.
I work. I had chronic back pain, and so I started off with using tramadol for my back pain. Doctor prescribed that, then it went to Vicodin, and that's how it generally is. It progresses. When you have a disease state, it progresses because as you use them more and more, your body develops what's called tolerance, and so it requires more and more to receive not only the pain relief, but also the euphoric effects, because there's a euphoric effect that comes with it. Okay? In your mind, you're saying, I need it because I have my back pain. So you're trying to justify why I need it and so forth, And I felt long as it was a prescription getting from a doctor, no big deal, right? Especially in the beginning. I mean, it's just a regular process. So nobody thinks, I don't have any problem with this. And so they use it.
Many people don't even realize they're addicted, first of all. And if you out there listening to this video, think about it. I guarantee you, many of you know somebody, if not a family member, a friend, or somebody at your workplace that has been or is addicted to opioids. Many times from prescription narcotics, we see people turn to street drugs such as heroin, which is, again, very dangerous.
Things are changing in my life because when you are on them, you have something called what's called brain fog. You don't realize what's going on, but you don't process your decisions as crisply. You can't make decisions as concisely, It's a little delayed, And so I needed to be able to manage that, I guess you would say, right? And so I really wanted to get off, but the thing that scared me the most was the withdrawal symptoms. When you come off of opioid withdrawal, symptoms can, involve vomiting, diarrhea, chills, shakes, fever. In extreme cases, it's requires medical attention.
Any substance, whether it be alcohol, whether it be nicotine, whether it be
cocaine, methamphetamines, we're going to take the same approach. We're going to teach coping skills and alternative behaviors and thinking patterns. Of course, when somebody stops using opiates, it's a very uncomfortable feeling. They become very sick, but as far as I know, nobody's really died from coming off of opiates. We got to treat vomiting, we got to treat, stomach discomfort, things like that. They have body aches, they can't sleep, but they get through it safely with no other medications.
What would you say, being a therapist, what is the hope for folks who are, stuck?
My hope is that they get hope, that there can be an end to it, because the reality is it either gets worse, they turn to street drugs, their families get destroyed, or death. Wow. It's a very dangerous drug. Wow. So more and more deaths will happen if people don't find hope and the ability to talk freely about it. Nobody raises their hand to become an addict. Yeah. It just happens. Yeah.
My life revolved around my next high. I didn't like myself and I didn't like my world if I wasn't high. It was like, that was my focus. That was my either taking it or finding it to take. There's peers that have the same problem, that are going through what you're going through. There are trained social workers. There's therapy, your family. Anybody that cares about you is a support system. They can help you, and lean on them. Don't be ashamed. Lean on them as much as you can, because you're going to need it. You're going to need all the help you can get, because opiates are, you feel good and you can function, and it's a trap, because it'll grab hold of you and you think the world's all good, but when your 2-week script was gone in 3 days, you got a problem.